Okay, so we're going to talk about some other roles of the RN. One thing I want to look at is still related to health promotion is Healthy People 2030. Healthy People 2030 is a set of goals, objectives for health for the nation for the next decade. The CDC has been doing this for several decades, and they update every 10 years and look at where we've come, where we've been, and where we're going. So you can look at this page and see some of the objectives that the CDC has for health for the next 10 years. I'm really curious. I haven't had time to really dig into it. I'm really curious how COVID has affected these objectives. So I want to move on, though, to some other roles of the RN. One of the roles is mentoring. You may see mentoring in a formal preceptor role. Preceptor works directly with a novice nurse or a student. They teach, they observe that person's performance, they offer guidance, they evaluate performance, and it's a formalized mentorship. We also, though, see a lot of informal modeling and mentoring. I can tell you that as a very naive novice nurse back in the 90s, I worked with a couple of the nurses I worked with in my early jobs were fantastic mentors. One of them was one of my official preceptors at my first job. The other was not an official preceptor, but she became a mentor to me on that job, and I learned so much from them. I was also, they were both RNs, but I was also mentored by several LPNs in my first job. I can tell you that the LPNs are the ones who taught me how to manage a patient load for the day, how to manage my day and get the cares done, because that was not something that my BSN program taught. We learned a lot about care planning and about the thought process of nursing. We did not get a lot of time in the clinical setting putting our hands on people, and the LPNs that I worked with in my first job were fantastic at helping me get through that process. So mentorship is one role of an RN, although it can be filled by by LPNs as well and others. Another role is leadership. As a nurse leader, the RN on most units is going to delegate care to other RNs, to LPNs, to CNAs within the scope of practice. Okay. As a novice RN, you may be delegating to LPNs with more experience. Keep that in mind. As LPNs and paramedics who have some healthcare experience, you're in a different position than someone who comes in directly as an RN and has no healthcare experience and then is required to delegate to people who've been working in healthcare for a while. But you may be delegating even as a novice RN. Delegation there are a lot of legal ramifications, and we're going to talk about that more in depth in the legal lecture later in, I think this unit. Yes, this unit. I think it's the next lecture. As you develop some experience, then you may be delegating to other RNs. You may become the charge nurse. You may move into management. So nurse leaders delegate care to other nurses and nursing staff. LPNs also delegate within the scope of practice. If something is not in your scope, you cannot delegate it to someone else. If it is not in their scope, you cannot delegate it to them. So as a nurse, I cannot delegate prescribing a medication to another person because that is not in my scope of practice. I can request that someone whose scope of practice includes medication prescription, but I cannot delegate that to them. I can delegate administration of medications to someone as long as it is within their scope of practice because it's in mine. So just some basics of delegation and leadership. RNs may also move into management. Most facilities will not hire for management without an RN. Some of you as LPNs may have some experience with management, particularly in long-term care settings. It's more common, but most of the time inpatient settings are going to require an RN for management. As a nurse manager, you manage human resources. That means staffing. You may have input or decision-making capacity in budgeting. You manage the workflow and the work environment on the unit. And then a good nurse manager is critical to a unit working smoothly. Okay, we're going to stop this recording and move on to the next one.